Hi, everyone. My name is Wade Costley, and I'm the website information officer for My CP Guide and the board director at Cerebral Palsy Australia. Welcome to today's webinar, which is about cerebral palsy registers in Australia and around the globe, and the stats and the stories behind them. First, I'm just going to start our session today with an acknowledgement of country. I acknowledge that I am hosting this webinar from the lands of the Boomerang people of the Kulin Nation. I also acknowledge the traditional custodians of the various lands on which you all reside today, and any Aboriginal and Torres Strait Islander people participating in this webinar. I pay my respects to elders past, present, and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures. A few things to note before I introduce our presenters today. First of all, today's session is being recorded to publish later on the MyCP Guide website. Attendees' names will not be visible in the video recording, so for anyone who may have concerns about identifiable information, please be assured you can take part in the later Q&A segment and you'll be anonymous in the published recording. Secondly, for the Q&A segment following the presentation, we encourage you to submit any questions or comments you have for the group by clicking the Q&A chat button and submitting your question there. Please note that attendees' microphones are muted by default throughout the presentation. So if you have an accessibility need or preference to ask a verbal question instead, please click the raise button with the hand icon and we can unmute you. Lastly, if you wish to use closed captions in this session, you can go to the top menu and click More, then Language and Speech, then Turn on Live Captions. Again, that's More, then Language and Speech, then Turn on Live Captions. These are automatically generated captions provided by Teams, so they may not be exactly word perfect, but they're still pretty good. So now for the big event. Today we're very excited to have Professor Nadia Badawi, who's a global leader in the research of newborn brain injuries and cerebral palsy, and adjunct professor Sarah McIntyre, who's a program lead for epidemiology at Cerebral Palsy Alliance and also the chair of the Australian Cerebral Palsy Register. Nadia and Sarah have been working with cerebral palsy registers for a number of decades, and they are both passionate about the importance of registers. And today, Nadia and Sarah are going to talk about how cerebral palsy registers are more than just data collections. They are actually driving meaningful change. So, Nadia and Sarah, I'll hand it over to you. Thank you.
Thanks very much, Wade. We're just going to pull up our slides to start. We're really excited to be here with you all today talking about the registers. All right, so Wade's done a great introduction of us. I don't think we need to do anything more than that. So Nadia and I are really excited to be here to talk to you today about the Australian and registers around the world to cerebral palsy registers, stats and stories.
So Sarah and I both are very fortunate. We work with the Cerebral Palsy Alliance, which is, as far as we can demonstrate, the oldest organization in the world providing services to people with cerebral palsy and their families, and driven very much by our founder's vision, the McLeods, who were parents. And they had a vision that they wanted to have a future where nothing is impossible for people with cerebral palsy and similar conditions. And interestingly, they were really interested in research at a time when people really weren't talking about it much. And I've got a picture of Rob White, our incredible CEO, but I'm also very pleased that Sarah and I spotted Morel Thornton in the audience, and she was chairperson of our board and incredibly invested in research. And we're just thrilled that she's here with us today. Excellent. We're having a problem moving our slides, but so the next slide is actually going to show our research program. And this is something that I think is really unique about Cerebral Palsy Alliance. There was a survey carried out by Sarah and Iona and Ann Cusack, and they surveyed people who live with cerebral palsy, their families, researchers and scientists, to set the priorities for what was really a world-first research institute focused on cerebral palsy. And you can see these are the 5 pillars which actually have been expanding. And there was to look for the causes of cerebral palsy, and you could see the register is in blue: prevention, treatment, search for a cure, policy, assistive technology. We're actually expanding. And you can see that the register was something that was the basis of all that we do. I always say, and they laugh at me because of course it's up in the cloud, I always say if CP Alliance burns down again, I'm running out with the register because it is so critical to everything that we do.
Okay, so what we wanted to do just to start with was just have a general idea of who's in the audience. So apart from Morel.
And Dinah.
And we've got Dinah, yeah, and a couple of others. So if you could just put in the chat, if you're a person with cerebral palsy yourself, if you're a parent or a sibling, a grandparent of someone with CP or, you know, like conditions, if you're a clinician, a researcher, or people working on other registers or anything else we haven't thought of, and warmly welcome you to. So just put that in the chat so that everyone can see who's in the audience as we go. Okay, so today what we're hoping to present to you is what is a cerebral palsy register, what are registers, what do we know because of the registers and the research that surrounds registers, examples of research involving the register. And then we'd also be really keen to have a brainstorm with everyone else about what other things would you like cerebral palsy registers to do. So a register is really an organised program for the collection, storage, retrieval and dissemination of a clearly defined set of data. And we try and keep it as minimal as possible, collected on identifiable individuals for a specific and specified purpose and within a specified geographical region. And Nadia and I were having a little chat about this and realised that, you know, what registers are we all on? Like, we're all on many registers. What registers are you on?
Well, I'm, you know, mammogram, pap smear, the ATO, I'm sure, is a register we're all on.
Yeah. My husband received a letter in the mail yesterday and it said register. And I went, well, what's that?
Yeah.
And it was a small business register. So we're trying to demystify what registers are, I think.
And it's part of the reason that actually the health system is so good, that there are all these registers that keep track of, you know, what prevents and screening.
Yeah, absolutely. So this is a little snapshot of the registers in Australia. So for people who don't know, we have individual state registers in Australia. And as everyone knows, health systems are different. disability systems are different across states, so we do have to have individual state registers. And we've got a lovely photo up here of all our colleagues, or not all of them, but a lot of our colleagues from around the states that work on these registers with us. And we'd like to pay tribute to the organisations who support the registers in each of the states as well. And you can see that the earliest registers were in Western Australia, and then Victoria, and followed by South Australia. And then the rest of us came on board in around 2004. And then we made the Australian Cerebral Palsy Register in 2008. This is thing again, sorry. No. So we like to think of the work from the registers as really starting with people with CP and their families. Obviously, this is all the data that we collect on people with CP and their families, but also we have advisory groups based at the state levels and at the Australian register level, making sure that people with CP are in the middle of the decision making for all our research that we do, plus all the new data points that we collect, and any questions that they have coming from other people with CP can come directly to us so that we can get those answers straight to them. At the state level, we can do things like link the state registers to things like hospital records, to birth and death registers, to inpatient and outpatients, to education, and we can really do big population level research. And I think that's what puts the register apart from any other pieces of research, is that it's totally population based. That means that we don't leave anyone out of research when it's based off a register. We also recruit for studies for other groups, and then we go to the national level. And at this point, we combined all the state data into the national data. It's de-identified at that point, and then we can run big Australia-wide combined data research and reports. And then internationally, a really important component of our work is our collaborations with the surveillance of cerebral palsy in Europe. Our friends, the Global Low and Middle Income Countries Cerebral Palsy Register, and New Zealand Aotearoa as well. I thought it might be good just to show how we actually collect data for registers. First of all, we get a team together from a state, and we apply for ethical approval. And I've gone plus because we might have to do lots of ethics for each state. And then we work with colleagues in health and in disability to identify potential new people to put on the register. And then we go to those sources and we review notes to determine who's eligible for the register. Then we send, this could be slightly different state by state, but this is a general idea. We send opt-off information to families who then have a choice to be on the register or not, or decide not to. Then we collect the data for a registration after we've given about 8 weeks for an opt-off period. Then we send research invitations and newsletters to people regularly so that they have other options to opt off, but so they also stay informed with the work that we do. Regularly, we upload de-identified data from each state to the ACPR, and we report all this back to ethics every year, and then we start again and we move on and find another group of people to add to the register. And what this means in the end is that we have a Australian CP register where it looks like a bunch of numbers there on the screen like that, all de-identified. But we know that every single line in that data set is a child or an adult and a family, and a really important story that we collect with much respect as we collect that data, knowing these stories are going to unite people and drive change. So currently we have around 11,700 people with CP on the Australian Cerebral Palsy Register, and that's from birth years 1995 to 2018 and counting. The way we work with the register once we have the data is that we do research across the lifespan. So from preconceptional research through the pregnancy, perinatal period, infancy, childhood, adolescence and adulthood. And we just want to give you a snapshot of this today. These first four here are really about etiology and causal pathways and prevention of CP and severity minimisation. And the childhood, adolescence and adulthood focus is really about reporting trends, advocacy and accessibility and participation and quality of life.
And I suppose that one of the other things I do in my professional life is work in newborn intensive care. And I think people will be surprised to know how often the register actually informs what I and my colleagues are doing. So we know from the Australian Register that at least 50% of the babies who go on later to be diagnosed with cerebral palsy will have spent time in a newborn intensive care unit or a special care nursery. And I think people are surprised to know that 10% of all Australian babies actually spend time in a newborn intensive care or special care nursery. And so why? There are many reasons, but one of the reasons that the register highlighted was that 11% of people with cerebral palsy were either a twin, a triplet, a quadruplet. And this is important because Australia has been incredibly successful with IVF or artificial reproductive technology. If you go into any classroom now in Australia, there will be at least one or two children who were conceived this way. And one of the side effects, I should say, of artificial reproductive technology was the increased likelihood of having twins or triplets. People would put back more than one embryo to have a higher success of pregnancy. But because of the registers, it was realized that actually, if you look at twins, triplets, much higher rate of cerebral palsy. So the Royal Australasian College of Obstetricians and Gynecologists, having access to all of these registers and data sets, were able to be informed and strongly recommend that only one embryo be reimplanted with IVF.
And here's an example of some of that research that's happening right now. This is predominantly work of Michelle Hanson in WA and Shona Goldsmith. And so we wanted to look at, with these changes in reproduction from the guidelines, whether the rates of cerebral palsy would be going down. And so we can do that because we can, if you see the bit that birth defects and CP register, water from WA down there, we were able to link these data sets and then find out these answers. So the answers so far, and this is still work in progress, you can see that here that CP is going down following that change in, whoops, we've lost our one. There we go. Following that change in single embryo transfer. So it's gone down from 7.2 to 2.9 per 1,000 live births. But it's never straightforward, is it, Nadia?
No.
So one of the new findings that we've identified, and this is something that you wanted to look at for a long time, was whether ovulation induction, so this is medication, that women can take to rather than going through IVF, whether that actually inferred a higher risk of CP. And in this new study, we've identified that this was the highest risk of CP from women using ovulation induction. So new research still to come out, and we'll let you know when this is further worked on, but wanted to update that.
And to go back to the babies that I look after, we see that nearly 42% of people who go on to be diagnosed with cerebral palsy were born prematurely. That is before 37 weeks. Now, Australia actually has quite a low rate of premature birth. It's 8.5%. And some countries have double that rate. So we know that these babies end up in newborn intensive care. And again, what can we do about that? So work which we have collaborated with people around the world. And I think this is something that I really want to say is a really good point about Cerebral Palsy Alliance. Because we're started by parents and the board, many of them have lived experience, the goal of our institute has always been to collaborate. And this is one of the great examples of collaboration. It was noticed that a drug called magnesium sulfate given to a woman going into very premature birth was actually protective of the baby's brain. And Sarah and I have been working with people all around the world trying to make sure this is implemented. And actually Cerebral Palsy Alliance helped Professor Caroline Crowther from Adelaide employ midwives so that in the hospitals, it went from a 20% uptake to nearly 80% in a couple of years, which is extraordinary because, you know, what I've seen is medicine, it takes about 10 to 20 years to get things implemented. And this is now the standard of care around the world for very preterm babies, as well as antenatal steroids, which was a New Zealand discovery. And again, that's over 90% uptake, protecting the brains of babies in newborn intensive care who are preterm. But again, from the register, we realized how high risk the babies were in intensive care. So what we did is actually get together. We have better protocols around it. Newborn intensive cares are a much more humane place now. When I was working early on, parents weren't allowed to visit, holding your baby, all of these things were less recognized. Now we're doing much better care, promoting development by encouraging reading, encouraging skin to skin care, managing babies' pain and stress so much better.
And actually we still see some of those practices in other parts of
Yes, I know.
that we have, that we're
which are very hard.
Yeah, which we're working with them to try and change that too.
Yeah. And we wanted to point out that, yes, a lot of the people who go on to have cerebral palsy were in a newborn intensive care or special care nursery, but actually this beautiful data from the Victorian CP register, which is first rate, really an amazing register, shows that in fact there are a group of term babies, who are the ones who are in green, and they will never have been seen in a newborn intensive care unit, but they're out there in the community, attracting no attention, and then later their families are asking for help and a diagnosis. And for those babies who, a small group, term, who've suffered a lack of oxygen around the time of birth, this was therapeutic cooling or putting the brain into a sort of hibernation. That has been shown to decrease the risk of cerebral palsy in those babies by 15%. And again, we learned from the magnesium sulfate story that as soon as this was shown to be effective, within a year, we worked with the Department of Health to get it into routine care.
That was one of the fastest uptakes.
Yeah. And one of the things, again, from Shona, she's online with her PhD and for other studies around the world, showing that nearly a quarter of all people with cerebral palsy will have what we call a congenital difference or a congenital anomaly, which is associated in some way with them having cerebral palsy. So what does that mean for someone like me? I have about 200 babies who come to my unit each year with congenital heart disease, and they would often come undiagnosed, quite unwell, maybe have had a stroke before they get to us. So we're doing so much better with diagnosing these conditions during the pregnancy and getting the babies to a unit where they can be looked after. And this beautiful little baby, Atla Marie, came to us actually from New Caledonia, flown in during the pregnancy, and she's had a wonderful outcome. Another part of the research that Cerebral Palsy Alliance was very proud to fund was some work around the genetic basis. So when I went through medical college, I was taught that only 1% of cerebral palsy may have a genetic or something different in the gene. We funded Professor Alistair McLennan and his team's work in Adelaide, and they showed that actually it's somewhere probably around 30%. And what does that mean? It means we can look for treatments that might work better, or better ways to support individuals with cerebral palsy and their families. And this is an example of an American family. Their daughter has a condition called NGLI1, and they've actually got a Nobel laureate working with them, looking for better treatments and maybe a cure for this congenital form of cerebral palsy, because unfortunately it can be lethal eventually. And this then resulted in, again, in us setting up an international cerebral palsy genomics consortium. So, because sometimes you can find that they are rare genes. Now, we might have 1 or 2 people in Australia. We're a small population. Maybe there's 10 in the US with the same gene change, 20 in China. So it's all about pooling resources and trying to get answers more quickly. One of the things that I see, again, it's in that theme of genetics. With migration patterns in a lot of countries, there's never been a time in human history where more people have been on the move. It's quite incredible. And what we're seeing, that cousin marriages can have a higher risk of cerebral palsy. We know from our global work that in some countries, like Arab-speaking countries, 37% of children who later have cerebral palsy, their parents were first cousins. And this just comes because people don't realize the effect. Babies who had these conditions would have died in the past. They come to Australia, we will have amazing free intensive care treatment, and then the diagnosis happens. And we're working with communities to try and give support and give genetic counselling.
So this is also some work that's come from Hayley Smithers-Sheedy off the register. And so just like genetics, another whole area of work is infection during pregnancy. And cytomegalovirus was something that we wanted to have a really close look at. It was one of the few things that in the early days where we were sure that it does cause cerebral palsy, but we didn't really know much about it. So Hayley went into a PhD on CMV, and it has become a beast of huge proportions that she's leading now with a whole group of people around the country. But how it started on the register was we sent invitations to people on the New South Wales register to test children's stored newborn screening cards, a little blood spot that was pricked at birth on the heel, and then we store that. It was set for molecular testing of CMV, and 323 children were tested who had newborn screening cards available, and around 10% had CMV DNA detected on their newborn screening card. And we have a saying at work that small pathways are us with cerebral palsy. So 10% was actually really quite a huge number, and something that we really needed to work on further for that. So Hayley and her team are now leading a huge amount of work developing resources for information for families and for health professionals. They've developed e-learning programs for midwives, GPs, obstetricians about knowing how to talk to families about CMV, when to test. Social media and mainstream media campaigns are being done every year, and we've just had the June month of CMV Awareness Month just recently, so that families also know about CMV. We've created a CMV Disability Prevention Network, and now also a CMV register looking at understanding long-term outcomes of CMV following new treatments for CMV as well.
It's surprising how many doctors and nurses don't know about it.
Yes. Well, when they started, I think Antonia Shan's research showed that I think it was like 60 or 80% didn't know anything about it. So that's changing now, which is wonderful. Now, when children turn around the age of 5, we go back and we make sure that the information that we've collected is accurate. We update information, and for the purposes of a register, we confirm that that the child will stay in the register and they have cerebral palsy, or they don't, and if they don't, they come out of the register at age 5. So when we do that, we like to do our major reports, and every 2 years it is, we do a report to update the prevalence and the trends of cerebral palsy over time. And so you can see here that the rates of CP in Australia have gone from around 2.2 per 1,000 down to 1.4, and these dotted ends of the line they're not confirmed yet because it takes a fair amount of time to get everyone in the register. So we think that'll probably go up to 1.3 next time we have a look. So, but what it means is it's about a 40% reduction in cerebral palsy over this time period, which is quite astonishing amount. Before that, if we go back before, it hadn't changed for over 40 years. Yeah. Then we can look at trends over gestational age groups. So we can see here that the smallest babies under 27 weeks, there's 11% are under 27 weeks. They've had a big reduction from around 110, 120 per 1,000 live births down to 60. So that's like a 50% reduction over time. And you'll see that there's a little slight increase there in just the recent years, and we'll talk a little bit about that later. Where the big changes have happened is for term births. So 37 plus weeks, you can see that 58% of children are born at term, and the term rates have also gone from 1.2 down to 0.9 per 1,000 live births over the same time period. Some work that we're really proud about is our work looking at prevalence and trends for Aboriginal and Torres Strait Islander children living with cerebral palsy. And this first piece we call the bird's eye view, and that was Tan Martin, who's our first author here. There's Tan, cheeky Tan there. She's cracking us all up with some sly comment there, I can see. And Tan is an Aboriginal midwife and researcher who's been working with us for about like 6 to 8 years now. Yeah, maybe up to 10 years, the way time flies. And so we were really excited to be able to do our first paper on this, and it showed that rates for Aboriginal children is also declining at a similar rate to non-Indigenous children. It's still slightly higher, but it's declining at the same rate. So that was really exciting, positive news. There's still things that we need to work on, such as 1 in 5 children living in remote and very remote socioeconomically disadvantaged areas. And the point about highlighting that is to really advocate for services so that children in these areas are not missing out on services.
And this is another way that I use the register at work. So I was a bit horrified to see that, in fact, we are diagnosing cerebral palsy very late. So only 21%, that's the little area in green, are diagnosed before 6 months of age. And why is that important? It's because they're not getting early intervention. So for an adult who has a stroke or has something else, quickly, within 3 days, they're getting physio so that they can be more mobile, regain their speech, be able to move their arm. And this is why the register really has informed a lot of what we do. And if you see, it's extraordinary, isn't it, that in a country like Australia, you're going to see that a large proportion are diagnosed after 3 years. We can do better, we think.
Yeah, we see that, you know, as we're collecting data all the time.
And so this is probably one of the most important meetings that Sarah and I have been at, and here we are at either end of the slide. And in this meeting, we got together a lot of the world's experts on early detection and neurology and development, and came out with a statement that has been published in 2017 about the imperative globally to detect early, accurately, and intervene early to get the best outcomes for babies with cerebral palsy. And it's published in the highest impact pediatric journal, JAMA Pediatrics, and it's been cited. That means other authors have referred to it nearly 2,000 times, which is extraordinary in the medical literature, showing the impact of this work. And from my perspective, you know, parents in NICU tell me they know their babies are at high risk and they want us to get in early, make a diagnosis, and then do something about it. Because they found that over time, the stress, the uncertainty of going to people who are in health and saying something's different about my child's development, and they want help and support. And this really drives us as a group. There are many proven benefits of early intervention, but this is one showing, this is from our amazing Scandinavian colleagues, showing that when a baby has had a stroke, so they have a hemiplegia, which means half their body is affected, that getting in early and making them use the hand or even both hand, the hand that had been affected by the stroke, increases the ability to recover and to use it for hand function. So just showing proof, 3 to 5 months of age, and yet we're only diagnosing about 21%. So this is what really makes this so urgent.
Okay, so we wanted to also highlight a few things so that we've spent a lot of time in the NICU.
Oh, well, it's what I do.
Yes, but we also work with people who are older than babies and young children. And this is some work from the Queensland Register from our friend and colleague Jacinta Quartermain. So she did her PhD on participation for people with cerebral palsy. And you can see here a number of articles that she did looking at how to measure participation and to evaluate involvement of people in day-to-day lives and how to improve that. Then she looked at positive and negative participation of young people and like what are the factors that make participation positive or negative, I should say, for young people with CP. And then she had a really in-depth look at discussions with people, young people themselves. And this is young people from 15 through to 25, I think, from memory, about what participation means at home and what makes it sounds strange, doesn't it? But you've got to make sure that people are participating and not just attending. And so what makes it a participation when you're at home, and then the same thing for when you're out in the community as well. And she identified these 6 elements here that are important. And in the community, it was more of a push and pull between barriers and things that supported participation. If you want any more information about this, we can send it through to you. But again, these were young people that came off the CP register who participated in this work. And then in adulthood as well, we also love to work with adults when they come to us with specific questions about their cerebral palsy and things they've been thinking about possibly for years. And so we had a wonderful, I'll take you through this scenario here. I just want to introduce you to Fiona first.
There has been a strong focus on legal aspects of CP because they are visible.
Thanks.
However, as it is a neurological condition, It is multifaceted. I have always had trouble controlling my emotions.
Yeah.
I have a very short fuse. Depression and anxiety tends to come over me quite suddenly. Years of psychological intervention had not helped. A couple of other people with CP started talking to me about it. So I wondered if there was a correlation with CP.
So we love it when someone comes to us with like lived experience questions such as this, and we didn't know the answer to that. We looked in the research literature, and there was a couple of things that were talking about basal ganglia injury and the potential for that to happen. So what we did was a survey with people off the register, and we found that there was an increase of depression and anxiety associated with emotion regulation. And so this started the next part of the work.
The study results did surprise me. Naturally, I was keen to find out if something could be done to help, as I did not want people who came after me to suffer like I had. So I thought mindfulness was worth a try.
We thought it was worth a try too.
The study results.
So what we did was set out to, led by Hayley and Ingrid, set out to do an RCT looking at modified mindfulness for stress reduction for people with CP and for those who had emotion regulation difficulties or anxiety. And so it was a 9-week program and we had about 30 adults who participated in this RCT. And we found that we had some good outcomes and that really mindfulness could be part of a whole suite of interventions that could help with mental health. And we've also done a qualitative study that Georgie Henry is leading, and people really enjoyed this intervention. And we have manuals now that are available for anyone who wants to set up these programs for adults with CP.
Future generations. I would like parents to be aware of the fact that there is a higher incidence of anxiety and depression, as well as emotional dysregulation in CP. It is a balance. While we do not want to scare parents, it is important that they are not left in the dark, not understanding what is going on for their children. It is also important that support workers understand so that they know we are not just being difficult. Most of all, it is important for people with CP to fully understand their condition.
Thumbs up from Fiona. Thank you,
Yeah.
Fiona, for your awesome questions.
Yeah.
The future generation.
So, as Sarah was saying, that things keep changing. So now parents have requested that we offer resuscitation to babies who are 22 and 23 weeks gestation. And it's going to be it's being mandated that they are at least offered it. And this is going to change. The outcomes, we predict that we will see a tick up in the rate of cerebral palsy until we get to know how to look after these babies in the newborn intensive care units. I've already talked about the impact of migration and family marriages. And also now there's so much better imaging during pregnancy. People are wondering, what do I do with this results? What does it mean for me and my baby, and what can we do about it? And of course, thank you, Wade, for this, but the funding for the registers is something that we are continuously concerned about. Very little funding comes to the registers, and the Australian register is actually unfunded. It's supported by the Cerebral Palsy Alliance and the community, and we sort of live from year to year, don't we?
We do.
And we think it's such an important resource, and we want to keep it going. And then as soon as we also go to other important issues that we know that it's been a huge success around the world, the drop in childhood deaths. So pediatric deaths have halved in the last few years. But as a part of that is that there also is an increase in children surviving with disability, and they are not getting the care that is needed, especially when you think that 85% of people who live with a disability are living in low middle income countries. And we see this again from countries like Bangladesh, India, Nepal. You see the deaths going down, in red, and then you see the rise in disability that accompanies it. And we know it's very different to have cerebral palsy in a low middle income country. This is data from our colleagues who work in Bangladesh, showing that the rate, it's almost 3 times as high, and the GMFCS levels, 3 to 5, the higher levels are more common, and there's very late diagnosis. Often it can be around 5 years of age. And malnutrition in a poor country, when you have a disability, it's rampant. So we have partnered with, this is Gulam, who leads the global work. Some years ago, 15 years ago, he was my registrar. And one day he said, I love what the Australian Cerebral Palsy Register is doing. Is there any way that we could start cloning the register? And it's now in 21 countries, isn't it? And gets a lot of support from the Australian team. And it's one of the things I think we're most proud of. They now have, I think, nearly 12,000 people on the registers. And there are 5 hubs. If anyone's interested, and we'd urge you to look at it, this is the amazing website. There are 5 hubs, one in Latin America, Pacific, the Arab-speaking world, and Pacific. Do you want to talk about this?
Yes. And so this is just a map of where the registers are throughout the world now. And so you can see that this is our friends in Europe, the surveillance of cerebral palsy in Europe. They have about 18,000 people on their register combined. Australia and New Zealand, we're doing a lot of work together. And the orange group is the GLM, Global Middle Income Cerebral Palsy Register. These are the hubs Nadia was talking about: South America, Africa.
So I'm going to have to give a shout out to Morelle Thornton, who before she retired said to me, now I want a global cerebral palsy register. I had a giant gulp, but I think Morelle, I think we might be getting there.
Okay, so that sort of brings us to the end of our formal presentation. And what we'd really like to do is open up for questions, but also ask questions of you as well as people with CP and carers and everyone else who's on the line about additional things you would like CP registers to do. So we'll just quickly say this is our team at Cerebral Palsy Alliance. And thank you for coming today, and I will stop sharing so that we can just see everybody and
because this register, not to sound like a politician, but this register belongs to all of you.
And Nadia and Sarah, thank you so much for all of this information. It was incredibly enlightening, and it provides an insight into the value of these CP registers, and how they provide insights into the causes, early detection, prevention, how to treat CP, and it's a testament to that value that it has led to that significant reduction here in Australia of children born with CP. And then, along with the current studies of adolescents and young adults with CP. And whilst people are putting in their questions into the Q&A, I just thought I would kick it off with the first question, and that is, given that the Australian Cerebral Palsy Register, especially considering the state levels that Victoria and WA have been around for decades now, and the national one for a couple of decades now, are you thinking about using that data to forecast the potential future demand for services for adults with CP, given that now that there's evidence that as people with CP age, their mobility at some point rapidly decreases?
It's a very good question, and it would be a great use of the data, yes. And we were meeting with a rehab physician only last week, who we'd not met before, which was wonderful, an adult rehab physician, and he's really interested in doing that sort of work. So that's what we like to do, Wade. If we don't necessarily have the skills to do that, we make sure we collaborate with people who do have those sorts of skills and work with them to do that sort of work. But I think that's really important. And also, not only for ageing people of lower GMFCSs, but also ageing people of higher GMFCSs who are living a lot longer than what they did 30 to 40 years ago. So we really need to look after those people with high complexity as well.
Yeah, because as everyone reminds me, the babies I look after grow up to be adults.
Yeah, so unfortunately, we can't be kids our entire lives.
That was good. Fun news. Hi, Natalie.
Look, I didn't first of all, I came in a little bit late, so I might have missed a couple of things you've said. But one of the questions I wanted to know is, are people who were born before 1995 able to be part of the register? Because people have been starting to talk about ageing, and so that is a really big issue, and there doesn't seem to be a lot of information and very little understanding about how things interact with each other. So that was my first, and I have one other quick question. And again, this is the research, because I've also got a research background, but a different one. When I see rates of disability go down, I think great. Rates of disability go down, I think great. But that also means if people see, we can prevent cerebral palsy, then you start getting asked the questions, well, why should we have them in the first place? And, maybe they shouldn't have been born in the first place, or in situations where more children have been surviving, of course you get higher rates of disability. So you've got people going, well, maybe it's not worth saving those babies. So I just wondered how your research helps the advocacy against that view.
Let me answer the first bit and you answer the second bit. So the first bit, Natalie, is yes, we include people of all ages on the CP register, and from every state. It's just the ones that from the Australian register, where we put the de-identified information into one Australian register. We've just focused on 1995 onwards, but in individual states we have people going back to probably the 1930s is the earliest one I remember. Nadia, over to you. Very important question.
No, it's a very important question, what you say, and it's very easy for it to be misinterpreted. So when I work in newborn intensive care, what parents want is for us to try and help their baby have the best outcome possible. So actually, one of the things from the register that we didn't show a slide of is we've been very pleased to see that more people who have cerebral palsy in Australia are more able to participate in society because there's less intellectual disability, less epilepsy. And that's, in a way, almost more important to somebody like me to see that when people have cerebral palsy now, so that it's less affects them physically less, because we know from the register, things like chronic pain, hip dislocation, these are very important goals as well for the whole system. And I think that, it's a very vexed question. And how do we deal with both things, protecting babies, but also advocating, and we try to do both as hard as we possibly can.
Yes, that's one thing I was going to say, Nadia,
Yeah.
is that we see the role of the register as advocating and shining a light on people living with cerebral palsy. And the research about prevention is one piece of that. But the rest is about advocacy for people living with CP.
Okay, thank you.
And related to Natalie's question, so as we know, Australia is a nation of immigrants, me included. So, for those who have migrated to Australia and are not on the register, and let's say that they're adults like me, for example, I'm not on the register. So, would you suggest that we register in our respective states or territories?
Yes, Wade, that's a great idea. And we are starting a new project on this, and we for people who are overseas born. So we do have people on the register who are living in Australia that weren't born. Of course, we don't include them in the rates because it's about where you were born. But we're starting a whole new project on this. And so we want to shine a light on this group of people as well. So once we get this information out, I think it'll really raise awareness for people like yourself to know that you can put yourself on the register as well.
Okay,
So, yeah.
right, great. And then have you, so related to the data, so we've talked about forecasting and all of that. Do you think eventually we can get that to determine economic benefits as well?
Yeah, we have done some work on health economics of CP, and we've used the register for that purpose. And we also did an out-of-pocket cost for people with CP that we did a big survey through the register and showed, even with the disability insurance scheme, that people with CP have a lot of out-of-pocket costs. And I can see Sophie's on the call here. She was a research partner in that piece. So yes, we health economics is something that we can definitely do more work in.
That's great. I think that the more data you get and the more people know about these registers, they'll provide, more benefit as well. And I think also your collaboration with other countries just really brings a lot of benefit as well to it.
Yeah. We've just been in Heidelberg actually last week. For every 3 years we have a big international meeting so there was over 2,000 people. They said 3. Yeah, got up to 3,000 people there. All people who are, either people with CP or other similar conditions, plus clinicians, researchers, epidemiologists, policy people, all coming together to try and work together for better quality of life for people with CP. But one of the things we have on these every 3 years is a World Register Congress. So we bring all the register people together all around the world, and we were hearing the most amazing speeches from Sweden to Malawi to Bangladesh to Australia, and there's a real highlight, just learning from each other from all around the world. Thailand is starting one this week. They've got their ethics through. So it's an ongoing growing field across the world.
That's great to hear. And does anyone else, I know we've been going and we're actually over time now, but does anyone else have any questions for Nadia or Sarah?
We couldn't see the questions because we're on full screen. So are there any that we've missed?
I don't see any others, but I think that's it. So once again, Sarah and Nadia, thank you so much for your time and just all the information. I think it was very valuable for everyone at the webinar, and it'll provide additional benefit for those who watch the recording as well. So thank you very much for your time and the presentation as well.
Thank you so much.
Thanks,
All right.
everyone.
Thank you,
Bye.
everyone.
See you soon.
On my CP guide, we actually do have links to not only the Australian Cerebral Palsy Register, but also the registers for each state and territory. And I'll actually show you that right now. So, so basically, if you go to mycpguide.org.au, there we have just hundreds of information resources about cerebral palsy. We also have publications in easy English, and we have essential websites for those with CP and their families, as well as blogs that give really good stories about people with CP and what they do. But specifically for the CP registers, the way to find them on my CP guide is go to information resources, and then you'll find all of these different categories. You can then go down to prevention and research, and then scroll down and you'll see the link for cerebral palsy registers. You can click on that, and then you'll see that we do have a explanation of what the cerebral palsy registers are for, and then the links to the national register, as well as each register for the respective state and territory, and more information about them.